Peter Block for On the Scene here at Orlando at the annual AHA meeting. With me is Michael Ong from UCLA, and Michael has done an interesting study called the Beat Heart Failure Study. Michael, tell me what this study was. How did you do it? What were you interested in?
Sure. So we were interested in seeing whether or not we could pair remote patient monitoring technology with care transition type of interventions to try to reduce readmissions and mortality for patients with heart failure that are discharged from the hospital.
Okay, so tell me what all those words really mean.
So when people got discharged from the hospital, we made sure that they knew how to take care of themselves, but we made sure that we also gave them telephone calls on a weekly basis after they left the hospital and monthly up through 6 months. And we also gave them devices that were Bluetooth enabled so that they could send information about their weight and also about their blood pressure and heart rate and symptom information back to a centralized call center that we managed so that if they ran into trouble, we could then give them a call and troubleshoot and then contact their doctors to make changes accordingly.
So were there folks that did better at this than others?
So when we look at all comers, we actually don't see any differences in terms of readmission or mortality. That being said, for those individuals who complied with at least 50% of the intervention, whether it was telephone calls or with the telemonitoring type of equipment, those individuals substantially benefited both in terms of mortality reductions as well as readmission reductions.
So subgroup analysis, I guess, multifactorial subgroup analysis looking back, made some difference in some groups. So doesn't this tell us that if you're a good patient and listen carefully to your doctor and take your pills, you do better than if you don't?
It certainly could, but I think that what we really need to find out is what the role of the technology really is. Does that closer monitoring really help individuals get over that hump so that they're able to do it, or would they have just done it on their own?
You going to do that with another trial?
We certainly can.
Okay, so there you have it. It looks like, at least for this group of patients, remote monitoring and lots of phone calls made no difference, but there were a lot of disparity in how these folks responded to that.
Definitely.
So we'll see whether or not these subgroup analyses won't go into another trial that may show us that there really is some help here, right?
I think so.
Thank you, Michael.